step. So if we have all of our feeds, let's say 3 hours apart, noon, 3 p.m., and 6 p.m. It will go throughout the day like this, but we have this schedule going of every 3 hours. If you have one baby feed at noon, and it takes them on average about 45 minutes to feed, change a diaper, burp them, settle them, and then the next one starts at 1, same thing, let's give them about an hour. That's done at 2, you're starting the next one by 3. So there's literally not even a moment for you to feed yourself, go to the bathroom, and care for yourself before you have to go back to caring for the babies again on this rotation of getting through their feeding and changing cycles. So that reason alone, we make sure that we keep them together and we do what we call tandem feeding. That basically just means that you're feeding them at the same time. You can either do this in different ways on your body. You can have 2 separate people feeding at the same time. You can have them propped up in bouncy chairs and you're holding the bottles and feeding them. If you're doing breastfeeding sessions, they have beautiful pillows where we can go ahead and do tandem feeds with one baby on each breast. If you have a third or fourth baby, we just rotate them through and we continue doing the feeding. But basically, you really have to make sure that when you're keeping your schedule of your feedings, if they stay the same, the rest of it can really be controlled or at least supported. That's more manageable than it would be as if you start to separate their feeds. Because if they fall asleep at different times or if they poop at different times, that's okay. But if you have to start a feed, which could take 45 minutes at different times throughout the day, it starts to just become a snowball of no break between one feed and the next feed, and no break between when you can have a little bit of a rest or a possible potty break yourself.